So here, the topic here is ultrasound guidance in neuromodulation and hybridissection. Here we use our skills in ultrasound guided and also the skills of the neurophysiology by the generator to get the functional recovery and pain control together, not just pain control. So here, the peripheral nerve entrapment are a common but often under-recognized source of the pain. Entrapment in neuropathy is defined as a pressure-induced segmental injury to peripheral nerve due to the anatomical structure or pathological process. So what happened to the entrapped nerve? The altered transmissions because of mechanical irritation from impingement of an anatomical neighbor. So many nerves travel through the body by tunnel or channel, like carpal tunnel, cubital tunnel, okay? So here a lot of structures surrounded like tendons, like muscles, like sheaths. So here this is the one of cause of the injury. So many nerves also have problem with the blood supply due to the blunt or crush injury or trauma. Also, all the nerves are supplied by the blood supply by vasonervorum, intrinsic or extrinsic. So when there is a damage or crush or a blunt trauma to the nerve will lose the blood supply and that lead to ischemic changes and then lead to the nerve damage. Okay. So here we have the normal nerve, compressed, sheath loss, disconnection, and degeneration. So this is the pathology of the nerve. After the nerve injury, what happened, the most important thing is the myelin sheath degenerated and then the nerve lost the function of transmission of the signals because there is no myelin sheath surrounding the nerve. So what is the mechanism? How the nerve is damaged? When there's a trauma to the nerve, the edema is started. So when the edema that compresses the nerve, there is a site of penetration of the nerve from the pathway to the fascia. So when the nerve is just balanced the penetration, the fascia strangulates itself because of the edema. So once it strangulates itself here, because of the swelling and edema and inflammatory process and the scar, the blood supply to the nerve lost, and then ischemic changes and demyelination, and the patient start to have motor or sensory deficit with the pain, ischemic pain. So this is started from the proximal to distal. That's why when we have any injury, radial nerve injury after fracture humerus or brachial plexus after clavicle injury, road traffic accident, for example, the patient started the pain after the surgery. There is some of them start complex regional pain syndrome or dysfunctional or disability of the limbs, even sciatic nerve, any nerve, any peripheral nerve. So we have also there is anatomical, for example, in pregnancy. Some pregnant ladies came with the lower abdominal pain, that because of the stretching of the abdominal muscles and the subcutaneous tissue, and then stretching of the cutaneous, anterior cutaneous nerves of the abdomen, and this is anterior cutaneous pain syndrome after pregnancy. This is one of the causes, for example. So, for example, there is entrapment of auxiliary nerve here between teres major and minor, especially in the sport trauma or sport injury, or carpal tunnel syndrome, or cubital tunnel syndrome. So, or post-operative, for example, after back surgery, some nerve insult by scalpel or by the manipulation, or in between bones like Morton and neuroma for digital or distal sensory branches of the nerves in between Morton and neuroma, because there is a conversion between two tarsal bones. So, this is, for example, axillary nerve damage. So the patient developed deltoid muscle atrophy and weakness and abduction of the upper limbs or pain. Or here, for example, common peroneal nerve compression by the cast. So a lot of people have fractured tibia. After that, the cast removed after 2 or 3 weeks, the patient feel foot drop. The problem was before cast, no nerve injury. But after cast, there's a foot drop or dorsiflexion weakness, partial foot drop. The cause is because the cambicular nerve is so close to the subcutaneous tissue and very close to the head of fibula. So when the cast is very tight, and that will compress the nerve and loss of a blood supply and then ischemic changes and then demyelination process. After remove the cast, the patient have weakness in the dorsiflexion. So, I will summarize the trauma, like this is one ulnar nerve. So trauma to the nerve would cause edema, which can travel proximal to distal to the injury. When the swelling reaches to the fascial penetration points, this can cause self-strangulation of the nerve and decrease the nerve growth factor, NGF flow. So shearing and penetration point can also cause entrapment, such as during, which I mentioned about cutaneous nerve entrapment syndrome during a pregnancy. So what is the hydrodissection? As you see in the video, the hydrodissection is inject of the fluid perineural area, not intraneural. Perineural to separate the nerve from the scarring tissue or the adhesions to release the nerve first and also allow the blood supply to back again to the nerve. What we need here, we need ultrasound, of course, because you cannot do that blindly. So this is got the skulls of the ultrasound on sound anatomy. Sound anatomy is very important here. So what is the mechanism of the stimulation? When we saw in the video, the patients after minutes, he could move the hands. The mechanism here, we know the nerve in human patients regenerate 1 millimeter per day. The electrical stimulation established that direct stimulation to the nerve enhances regeneration of the nerve. Why? What is the pathology? Pathophysiology. The pathophysiology, after damage of the nerve, the decrease nerve growth factors. So, who enhance, which is, factor enhance the nerve growth factor to release? It is a direct stimulation. Previously, the physiotherapists used the TENS, electrical stimulation, through the skin to the muscle to the nerve to enhance functional rehabilitation. But here, with the ultrasound, era of ultrasound and this technology, we can go direct to the damaged part, fascicles of the nerve. This is like invasive physiotherapy, we can mention it. So here, the direct electrical stimulation, there is no loss, no scar.